Our purpose of this study was to try to determine what would be the educational needs, the learning needs of non-oncology nurses who care for cancer survivors in non-oncology designated clinical units. So these are nurses who may not have received additional preparation in oncology or cancer care nursing. So what we did is we decided to go to the experts. We surveyed over 300 experienced oncology nurses who were members of ONS and asked them about over 30 cancer concepts, key cancer concepts that we had developed prior to this, and to rate the depth and the importance of those cancer concepts, what information or education is needed by non-oncology nurses. So then we went to one of the largest groups of non-oncology nurses, the Academy of Medical Surgical Nurses, and again asked over 300 of those nurses the same questions, what they think medical surgical nurses need to know or should know in caring for cancer survivors. We also asked them about barriers that they may often encounter in obtaining these learning needs. So as a result, surprisingly, both groups of nurses rated those concepts pretty similarly in depth and higher, again, in importance. There were some concepts that med-surg nurses actually rated higher in depth and importance. So what that gives us now is at least helps inform us in terms of what some learning needs may be for non-oncology nurses, in particular medical surgical nurses, the priority, and then at what depth do they need that information. We don't know, we're not saying that the care is poor quality care, that the care of cancer survivors is less than care, but what we do know is that we have the opportunity then to have an evidence-based approach to developing learning resources for those nurses. And hopefully, possibly then looking at developing scope and standards for non-oncology nurses, because there's scope and standards for specialists, for clinical oncology nurses, but no standards of care for non-oncology nurses who encounter the cancer survivor in a lot of settings.